It is, of course, National Heart Month, and today Dr. John Day with Intermountain Medical Center Heart Institute joining us. Thanks for stopping in.
Oh, my pleasure.
We appreciate it. Okay, you're going to talk about the 5 numbers we should all know when it comes to our health. We're not talking cell phone numbers here. We're talking your health numbers here, the top 5.
Exactly. So the top 5, and these are numbers that everyone should know for a better heart. Heart disease kills almost half of all Americans, and so if we can focus on these, we can really change our health and our lives.
And some of these numbers are easy to get on your own.
Exactly.
Others you have to go get a test. But the first one we've got is your total cholesterol.
Total cholesterol. Now this is different. This is a combination of LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. The goal is to get it below 200.
You have to get tested for this, obviously.
You've got to get tested for this.
But you got to know this.
You got to know it. You got to know it. Cholesterol is important as far as preventing heart attacks, strokes, and other problems. Keep your total cholesterol below 200.
Okay, so the second one, let's go. This is fasting glucose. Now tell us what level. The goal on this one is less, or are we going to go to blood pressure next? Oh, blood pressure is the next one. I'm sorry. So we've got blood pressure is the next one, and the goal here is less than 120/80.
Correct. We want to keep our blood pressure below 120/80, and this is something that could be measured in the doctor's office, or even if you have a machine at your house.
Which is, it's easier nowadays.
Right.
I mean, there are a lot of different devices out there.
Exactly.
And what, again, why is that so key? What does it really tell us? Because some people think, okay, 120/80, but which numbers are more important, the 120 or the 80?
They're both important. If our blood pressure is above 120/80, we are slowly damaging multiple organ systems in the body. Our heart, our brain, our eyes, our kidneys. So we want to keep it as close to 120/80 or lower as possible.
Okay, next one, the third number we should know, fasting glucose. The goal here is the less than 100, right?
Correct. And this is part of a standard blood test that most doctors order. I would just recommend have it done fasting. If your fasting blood glucose or your sugars are between 100 and 125, that signals you may have pre-diabetes. If it's above 125, you have diabetes. So the goal is to keep it below 100. And this is critically important because half of all Americans here in this country are either pre-diabetic or diabetic. And most of them have no idea.
Okay, so under 100 is the goal for that. Now, resting heart rate, here's the key. The goal is between 50 and 60 beats per minute.
As close to 60 as possible. Typically, we've said an average heart rate is between 60 and 100. But there's new data coming out that as our heart rate gets higher, as we start getting above 80 beats per minute, that is a marker of increased risk of heart disease or death. So the closer we can get to 60 beats per minute, the better.
And before we run out to the last and the fifth one is the C-reactive protein, right?
New area of research. This is a marker of generalized inflammation in the body. We want to keep it low. Inflammation's good if you're sick or injured, but when it never turns off and if inflammation's on 24/7, 365, that's bad. We want to keep C-reactive protein less than 1.
Okay, Dr. Day, we appreciate you stopping by, and again, we'll have these 5 numbers you should know for your health and for your heart on our website as well. Thanks again.
Oh, thanks for having me.
Lori?